Polycystic ovarian syndrome, or something also known as PCOS, is a very common diagnosis that we're hearing a lot about these days in women of reproductive age. Basically, it's a very complicated disorder where women can produce many cysts on their ovaries, and ultimately it creates a hormonal imbalance throughout. Now, what's complicated about this diagnosis is that sometimes you don't always have cysts on the ovaries. There is a multitude of criteria that's involved with diagnosing PCOS, and oftentimes women are overdiagnosed with PCOS or polycystic ovarian syndrome. What's important to know that it is very common, and there's a whole constellation of symptoms that can be associated with PCOS. Most commonly, women with PCOS will potentially know that they have it by the loss of their menstrual cycle. So if many months go by and they're not really getting their period, this may prompt someone to go to the doctor to start looking into why this is occurring. There are many reasons why women can lose their menstrual cycle, but one of the more common reasons in society today is due to this PCOS that we're hearing a lot about. Women may also experience being a little bit overweight, have an inability to lose weight, and they may also sometimes have other symptoms like hair growth and hair in places where they wouldn't necessarily expect to have hair. These are some of the main tip-offs that can tell a woman that they have PCOS. So there is a wide host of options to treat PCOS, and it would be really important that you speak with a GYN or a gynecologist in your community who can help you, first of all, make the diagnosis. Many women today are quite overdiagnosed with PCOS because some women tend to be a little bit overweight, and as a result of that can lose their menstrual cycle. And sometimes the two are very much intertwined, so it can be a little bit challenging to completely differentiate the diagnosis, but the treatments sometimes are similar and there can be a lot of overlap. The first thing would always be to try to make yourself as healthy as possible with diet and exercise first, and eating a really healthy, balanced diet with lots of unprocessed foods. This is one of the main things that you can do to help yourself if you do come up with a diagnosis of PCOS. There are many apps and literature online that women can search for to help facilitate a PCOS diet. There may be medical options that will come up when you're speaking with your gynecologist. Some of these are in the form of supplements, some of them are in the form of hormones, and these are things that you would speak with your doctor about to find the right treatment plan for you.